On this schematic drawing, the spleen is displayed along the left abdominal wall. Occasionally, the spleen is displayed transversely to the spine, especially in large or deep-chested dogs. The panoramic image of the spleen on the right shows the long axis of the spleen as it lays lateral to the left kidney and can reach up to the bladder region. Often, the cranial tip of the spleen is close to the lateral portion of the liver, allowing a comparison of echogenicity between the two organs. In normal dogs, the spleen is hyperechoic to the liver. It is important to move the transducer along the entire width of the spleen, as we assess both its longitudinal and its transverse dimension. Moving to real-time assessment of the spleen, we'll start with the probe on sagittal orientation with the marker pointed towards the head of the dog. First, the probe is placed caudally to the funding portion of the stomach. There, the triangular cranial tip of the spleen can be seen. Then, the probe continues its trajectory caudally. Part of the kidney, small bowel, and descending colon can be seen in the far field, and the caudal tip of the spleen is reaching the bladder. Notice the swing motion of the probe as the operator evaluates the spleen. The probe is then rotated 90 degrees in the transverse plane. The marker is now to the right of the dog, and the spleen is displayed from cranial to caudal. Medially and dorsally, we can see small bowel segments and colon associated with shadowing and reverberation artifact. The splenic vessel appears as regularly spaced anechoic structure within the splenic parenchyma.